This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Invega Sustenna 100mg injection is an antipsychotic medication used to manage symptoms of schizophrenia. It helps patients stabilize their mental health. Indications and uses. This medication is indicated for the maintenance management of schizophrenia in adults who have been stabilized on paliperidone or risperidone. It aims to alleviate the debilitating symptoms of this severe mental disorder, which include hallucinations and delusions, thereby improving the quality of life for patients. How it works. Invega Sustenna works by blocking the receptors for dopamine and serotonin in the brain, which are critical in the development of schizophrenia. This action helps to normalize brain activity and mitigate symptoms. Directions for use. Invega Sustenna 100mg injection is administered as an intramuscular injection in either the upper arm or buttocks by a qualified healthcare professional. The correct dosage and duration are determined by the physician based on the patient's age, weight, and medical condition. It is crucial not to discontinue the injection without consulting a doctor, as this could lead to a return of symptoms. Possible side effects. Possible side effects may include difficulty sleeping, cold symptoms, weight changes, and more severe reactions that require immediate medical consultation. Patients should remain vigilant for any worsening of symptoms. Precautions and warnings. This medication should not be used in individuals with moderate to severe kidney disease and should be prescribed with caution to those with liver disease, heart conditions, or a history of Parkinson's disease. Pregnant and breastfeeding women, as well as children under 18, should avoid this medication unless supervised by a healthcare provider. FAQs. 1. What does Invega Sustenna do? It helps manage symptoms of schizophrenia by normalizing brain activity. 2. Is it safe to use during pregnancy? No, it is not recommended for pregnant women. 3. What are the common side effects? Difficulty sleeping and weight changes are common. 4. Can I stop taking it suddenly? No, stopping suddenly can cause a return of symptoms. Thank you for watching this video. If you have any questions or suggestions, feel free to leave a comment below. Your health is important, and we're here to help.